technology which have given data for real-world experience. So testosterone deficiency in men with type 2 diabetes is very common, and not many diabetologists are actually looking for it, and they should do. Back in 2007, we published in Diabetes Care, and we were the first to show a prevalence of 40% of men with type 2 diabetes having symptomatic testosterone deficiency. It had been known before that testosterone levels are low in diabetes, but nobody had done this. And there are several studies finding the exact prevalence that we found have been published since. Now, testosterone deficiency is associated with many adverse effects on cardiovascular risk factors, osteoporosis, muscular strength, including frailty, anemia, sexual dysfunction, psychological well-being, and several other things, including the brain. Now, testosterone replacement therapy is done in studies, and there are several studies now, and we were the first to show that testosterone improves on insulin resistance and improves HbA1c. Certain studies have not shown HbA1c increases, so what we want to do, decreases, sorry, so we want to do is we're using this big cohort, hopefully, that we'll get more information. We also know that testosterone reduces body weight and waist circumference, and we can improve sexual function and quality of life. Very important to the patient. Testosterone replacement also is associated with an increased mortality. We did a study with 581 men, and we showed that if you have a normal testosterone, your survival at 5.8 years is 9.6%, whereas if your testosterone is low and not treated, it's 20%. So it really indicates poor survival. And the ones we treated, it was 8.6%, so we had returned the normal life expectation by giving testosterone to these testosterone deficient men. Two big studies have been done recently. The T4D study in Australia, which is 1,007 men in a placebo-controlled study in men with pre-diabetes and early onset type 2 diabetes, and it showed that it reduced the onset of overt diabetes from pre-diabetes by twofold. And in those who had newly diagnosed diabetes, 13% went into remission. The Traverse study, a cardiovascular safety study, is published in the New England Journal of Medicine in July this year, and it showed there was no difference between testosterone and placebo arms in regard to new MACE events. So it seems to be quite safe in that respect, and people have been worried about that. So what we're doing with the Association of British Clinical Diabetologists is looking and see what people's practice is with testosterone and diabetes, and try to get a lot more data. So we're looking for more centres, so please join. There's an email here, but if you just Google ABCD testosterone audit, it will take you straight to it. So the purpose of the ABCD worldwide audit on testosterone and diabetes are as follows. The audit sets out to help individual clinicians and to determine from several centres the clinical effects and monitoring of testosterone replacement therapy in men with type 2 diabetes and hypogonadism in real-world clinical practice in the short and longer term. The data can be used from retrospective from patients already you have on testosterone or new patients you start on testosterone. It's an online audit tool, and there are paper forms that then you can fill those in clinic. Yeah. And go, yeah, I know, yeah, fine. And the patient details are encrypted. So we have 34 centres, 8 countries, 428 patients recruited. So we have a 2-year evaluable paired data on 104 patients, and that's what I'm presenting today in regard to HbA1c. So you can see the baseline data, and they were shown to be hypergonadal, proven by blood testosterone and hypergonadal score. So these are the results we have on the paired data. So the HbA1c, you can see at 3 months and 12 months and 24 months is similar in each cohort. But so in the 3-month cohort, you can see that there is a reduction from 71.27 to 66.26 millimoles per litre. At the 12-month, it's even greater, almost 10 millimoles per mole of HbA1c, and at 24 months, we're approaching 15, 16 millimoles per litre lower. So they're very significant results, p-value of less than 0.001, and 2/3 of these patients had no changes in their treatment, and the other third did, and mainly they were reduction in treatment. So the conclusions are early evidence that testosterone replacement in a population of men with type 2 diabetes is associated with a reduction of HbA1c over 2 years. This finding is supported by evidence from RCTs and registry studies. The audit with a greater number of patient inputted and longer term data is likely to provide valuable data on which patients are those which respond and those who may not. The audit will also provide evidence of longer term safety. So I will leave it at that, and are there any questions? Please take part in this study.
Thank you, Hugh. We only have time for one question. Is there anyone with a burning question?
Thank you very much. You said that testosterone replacement improves insulin resistance. Is the case also of the opposite, that improving insulin resistance can have a beneficial effect on testosterone levels?
So reducing insulin resistance, no, reducing weight can improve testosterone levels. Reducing weight can improve testosterone levels, but getting to the nitty-gritty of improving insulin resistance, it's acting on several different metabolic pathways, as well as reducing fat and increasing muscle.
Okay. Thank you very much. We need to move on. Thank you, Hugh. So.